Hello, my name is Jose Gonzalez,
My name is Brianna Gonzalez.
My name is Adamari Lozano.
and we are community health education majors at the University of the Incarnate Word. Today, we will be presenting our poster with our research on opioid overdose in undergraduate college students based on geographical distance from the Texas-Mexico border. Through meta-analysis in our research methods class last semester, we have been addressing a critical issue affecting our college campuses, which is overdose among undergraduate college students. This topic is not only urgent, but also deeply impactful as it involves the health, safety, and well-being of our peers.
The reason that we chose to do this study was that as college students, we are intrigued to know and learn more into the information of the lives of undergraduate college students. We're also interested in the specific location because it's around the proximity of our area of living. This study aims to identify undergraduate college students' opioid overdose rates in relation to geographical proximity of the Texas-Mexico border. The opioid epidemic has proved to be a significant public health crisis in the United States, affecting individuals across various demographics. Currently, there is a gap in understanding undergraduate college students' prevalence and patterns of opioid exposure, specifically among regions proximal to the Texas-Mexico border. So, to look at it at a broader opioid crisis, opioids are a class of drugs that include prescription pain relievers like oxycodone and fentanyl, as well as illegal drugs like heroin. The misuse of these substances has led to an unprecedented epidemic in recent years.
There are several factors that contribute to the increase of opioid overdoses among college students, such as academic pressure, this being the stress of college life that can lead to students to the misuse of opioids to be able to manage pain or anxiety, as well as depression. Social factors being the prevalence of opioid misuse in social settings and the peer pressures of their peers that exacerbate the issue. Accessibility, the availability of prescription medications can either be from personal prescriptions or illicit sources that makes it easier for the misuse of opioids, as well as the lack of resources, as some college campuses may lack sufficient resources in drug education, mental health support, and the overdose prevention. In addition, not knowing the availability and location of Noxicodone. Noxicodone is a medication that can reverse opioid overdoses. Last but not least, access to fentanyl-laced drugs. It's been an increase of synthetic opioids such as fentanyl in the drug supply market that has increased the risk of overdose. Students purchase these drugs without knowing what context it is made from that causes high risk, especially with small traces of fentanyl that makes these opioids lethal.
Recognizing opioid misuse early can be crucial. The signs you should be looking out for are changes in behavior or academic performance, unusual drowsiness or sedation, withdrawal from social activities, or increased secrecy or erratic behavior. The methodology that we used for our study was that we utilized a meta-analysis methodology. Evidence spanned from 2016 to 2024. The relevant academic search engines that we used for this research were Google, PubMed, Google Scholar, Springer Link, and EBSCO Host. For our results, the study identified 14 existing articles focusing on opioid overdose within the designated geographical location. However, only 5 articles focused on first-time undergraduate students enrolled in a 4-year institution. Data included geographical location, sample size, overdose rates, and demographic information. 26,073 undergraduate students were exposed to or experienced firsthand opioid misuse, with females resulting in higher rates of exposure than their male counterparts. Additionally, results suggest a rise of exposure rates among both African American and Hispanic populations, with Hispanics reflecting a significantly higher increase in comparison to the other ethnic populations. After repeated searches, the research team was unable to identify the precise geographical location with the highest rate of opioid exposure along the Texas-Mexico border. In conclusion, Since the beginning of the opioid epidemic, research and prevention strategies primarily focused on opioid misusers. Conversely, very little has focused on the burdens experienced by those who are exposed to opioids. Findings in this suggest that Hispanic females run a greater risk of exposure than their undergraduate counterparts. Surprisingly, data related to the specific geographical location rates of exposures were unable to be obtained, suggesting further research related to geographical exposure rates should be conducted. Lastly, it is recommended that the future research of focus on impacts related to exposure and interventions that focus on those who have been exposed to opioid addictions. And this is the conclusion of our presentation for today. Thank you.
Thank you.
Thank you.